Hey YouTube, does a high protein diet cause kidney failure? Short answer, no. Long answer, probably not. Okay, so maybe that intro is a little bit vague. So let's talk about how high protein diets have been linked to kidney failure in the past and why a lot of what we know about this is incorrect. One of the things I'm going to quickly touch on is how we calculate kidney failure in the average person, medically speaking. For those of you who don't know, I'm a registered nurse. Hi, I'm Mark. We look at a thing called EGFR, which is estimated glomerular filtration rate, which is a calculation of your serum creatinine clearance and how it affects the amount of blood that your kidneys are basically filtering. That is a very simplistic explanation, but just know that the higher your serum creatinine, the lower your GFR. All right. So what this means is if the average person has a high serum creatinine, it means that their kidneys aren't working as well as they should, which is bad, right? That's like pre-dialysis or pre-kidney failure. And we kind of use that as an estimate for figuring out if they're in renal failure. Enter the average person. However, we are not the average person. We are physically inclined. And about, decade or two ago, a lot of researchers sat down and said, okay, so if high protein diets cause kidney failure, which is what the average medical professional believed at the time, why aren't our dialysis units just inundated with jacked and tan bodybuilders, hockey players, football players, all of these really athletically inclined people? And nobody had an answer for that, right? You would think that if those of us that eat high protein diets would be in renal failure across the board. We don't find that. Why? All right, let's talk about that. So we talked about that thing, serum creatinine, right? Now, serum creatinine is basically how much creatinine is running around in your blood. But creatinine is found in muscle tissue and it's found in the foods that we eat, thinking protein, right? So if your serum creatinine is high, they're thinking, obviously your kidneys aren't working as well. But when we look at the average jacked and tanned individual, like myself, of course, we find that they have normally high serum creatinine levels and their GFR is lower. So does that mean that they're constantly in kidney failure? No. Now I have the opportunity to speak to a nephrologist, an internal medicine specialist, and an internist at my hospital on this topic. Why? Because according to my GFR and creatinine, I'm in renal failure and have been for years. I'm gonna throw myself under the bus in this video. Right down below me is my GFR over the last, I think, 6 years, as well as the numbers for my GFR. All right, and then my creatinine, serum creatinine, and the numbers for my serum creatinine. So according to these numbers, I'm in renal failure, or I'm pre-renal failure. So I spoke to an internal medicine doctor, I spoke to a nephrologist, I spoke to an internist. I have that ability at my job, thank goodness. I am very blessed to have those resources available to me. And basically the consensus from all three of these very highly trained medical professionals was, 1, you're jacked and tanned. Exactly what they said. I did not prompt them to say that. That was what they said to me, is you're jacked and tanned. 2, you have more muscle mass. 3, you eat a high protein diet. And I said, well, are all these things detrimental to my kidneys? And literally everybody all the way up to the nephrologist said, do you pee? I'm like, well, of course I pee. They're like, then you're not in kidney failure. That's a very simplistic overview. But the point is, a lot of the studies that have been done on individuals that have high serum creatinine are on sedentary or obese individuals or little cachectic people in a bed somewhere that aren't moving. Cachectic means lack of muscle mass, right? We often see like sarcopenic patients having GFRs that are really high, but they have, regardless. So, enter recent studies that have looked at GFR in athletic people, like this one here, and what they've concluded is that serum creatinine and EGFR is just not applicable to athletes. If you have muscles, boom. If you eat a high protein diet, it's not indicative of a renal failure. Yet, we need a lot more research on the topic, but what they're finding right now is that they simply don't correlate, they simply don't relate. And what they recommend, or what they said, is that cachectic individuals that have like lack of body mass are overestimated for their GFR, and jacked and tan people are underestimated for their GFR, meaning that if you have a high muscle mass, they think that your GFR is lower than it could be. You could have a totally normal kidney function, but they don't know because they're using an old, outdated, and inaccurate method of measuring that, the EGFR. So then, what do? We do what's called looking for clinical presentations of renal failure. If your GFR is low, they recommend that the doctor doesn't look at you and go, well, your GFR is low, you're in renal failure. Look for stuff like edema, look for like pain, look for the clinical presentations of renal failure. If those aren't present in an athletic individual, then you're probably not in renal failure. And that's huge that they're starting to do studies on this. So does a high protein diet cause renal failure? No, it doesn't. And a lot of the studies are showing that the problem is we can't say that it does. And you can argue, yeah, but a lot of studies have been done that say that it does. Right, but those studies aren't done on athletic individuals. The scientific consensus is not there, guys. Right? Now, I can't turn around and say it absolutely unequivocally does not. Oh, wow. Can you guys hear that wind on the video? Good Lord, Vancouver. The scientific consensus is that it doesn't, because we just simply don't know. There's a lot of studies that are coming out, bless these researchers who are finally saying, like, let's figure this out for the athletic individual so they don't have to be scared all the time if they're going to cause renal failure. But for now, that myth or that consensus is going to be pervasive in the medical community as well as society. High protein equals kidney failure. Now, if you are already in kidney failure, yes, a high protein diet is detrimental and deleterious to your health. And I will say that absolutely, I've seen it. If you're a dialysis patient or you're in renal failure, high protein diet stresses out your kidneys so much it can make it much worse. But if you're not in kidney failure, it doesn't matter what your protein intake is yet. Wait for more research. Don't freak out. That's it, guys. Eat your protein, right? I did a video that I'll try to link, but I'm super bad at this, on protein intake while bulking and cutting. Talk a little bit about how much protein you should be eating while you're bulking and cutting and maintaining. But don't fret, guys. If you don't have the clinical presentation of kidney failure, but your blood looks really bad and your doctor's saying, hey, you need to cut down on your protein, you can turn around and say, hey, what about these things? We need more data, guys, but right now, don't freak out. High protein diets don't necessarily cause kidney damage. They can exacerbate a pre-existing kidney failure, but they don't cause kidney damage, or at least that's what we know now. Questions and comments down below, guys. Please subscribe or like. It lets me know whether or not you like these types of videos. If you have any requests for videos, I'll do my best. I'm a brand new, well, not brand new channel. I just got back to this after years, so I got some time on my hands to make videos if you want. And as always, guys and gals, eat like a bodybuilder and train like a powerlifter.